First, a summary of the case. Maria Soriano is a 47 years old widowed mother living in Barangay Bagong Silang, Quezon City. With her two teenage children, she earned a living as a street vendor by selling banana Q and lumpia to support her family. Although she has been experiencing headache, chest heaviness, and fatigue for 5 months, she continues working because she believes that she is still healthy and as long as she can perform her daily responsibilities. Maria Soriano is a 47 years old widowed mother. With her two teenage children, she earned money by selling banana Q and a lumpia to support her family. For 5 months, she has been experiencing headache, chest heaviness, and a fatigue. However, she continues working because she believes she is still healthy as long as she can perform or do her daily responsibilities. This shows that Maria may not realize how serious her condition is. For the continuation, during a routine home visit, a barangay health worker or the BHW measured her blood pressure at 170 over 100 millimeters of mercury, indicating severe hypertension. Despite the nurse's advice to seek medical care, Maria refused because she does not feel seriously ill. She also avoids taking maintenance medication due to financial difficulties and fear of side effects. Her children are concerned about her health, but Maria prioritizes their education over her own well-being. So, Maria has a blood pressure of 170 over 100 millimeters of mercury, indicating severe hypertension. She refuses medical care and avoids medication because of a financial difficulties and also a fear of side effects. This shows that the importance of health awareness, proper treatment, and addressing barriers that prevent patients from seeking care. So next is the Be Relevant models of health and determinants involved. So health mother, Maria follows the functional model of health. According to this model, a person considers themselves healthy if they are able to perform their usual daily activities and fulfill their responsibilities. Maria believed that because she can still cook, sell foods, and care for her children, she is healthy despite having dangerously high blood pressure. The Health Beliefs model or the HBM also helps explain her behavior. Maria has a low perceived susceptibility and low perceived severity regarding hypertension. Because she does not experience symptoms like prevent her from working, she also perceives barriers such as medication cost and fear of the side effect, which discourage her from seeking treatment. So the functional model of health explains why Maria considers herself healthy because she can still perform daily activities. The health belief model explain how low perceive of risk and the barriers that discourage treatments. This model help explain how Maria believes responsibilities and financial concerns affect her health behavior.
Relevant models or determinants. This slides continues the discussion of the health models and determinants involved in Maria's situation. It emphasizes that health behavior is influenced not only by physical symptoms but also by beliefs, responsibilities, financial situation, and access to health care. Analysis using theoretical concept. Using the health belief model, Maria's decisions can be explained through several concepts. Low perceived susceptibility. She believes serious illness only occurs when a person becomes bedridden. Low perceived severity. She underestimates the dangers of controlled hypertension because many of its complications develop silently. High perceived barriers. Financial constraints and fear of medication side effects prevent her from accepting treatment. Limited perceived benefits. She does not recognize a long-term advantages of early treatment and regular monitoring. Limited cues to action. Although the BHW and nurse advised her to visit the healthcare, these recommendations were not enough to change her beliefs. Maria believes and perceived barriers make her less likely to follow medical advice and seek proper treatment. Analysis using theoretical concepts. Maria's situation demonstrates how health beliefs significantly influence health-seeking behavior. According to the functional model of health, she equates health with productivity rather than physical well-being. Since she remains capable of working, she assumes that her condition is not serious. This shows a person's definition of being healthy can affect their decisions to seek medical care.
Aside from her personal beliefs, this case also illustrates the social determinants of health, where poverty, limited financial resources, and family responsibilities directly affect health behaviors and access to care. This means that Maria's health is affected not only by her hypertension but also by her financial situation and responsibilities toward her family. Maria prioritizes meeting her family's basic needs over maintaining her own health, increasing her risk of complications. This means that she puts her family's need first, which may cause her to delay treatment or neglect her own health. Next, appropriate nursing interventions. Because of these concerns, the nurse should provide patient-centered and culturally sensitive care by respecting Maria's experiences while encouraging healthier behaviors. This means that the nurse should consider Maria's personal situation, beliefs, financial concerns, and family responsibilities when planning her care instead of simply telling her what to do. So these are the possible nursing interventions. The first intervention is to build trust through therapeutic communication and avoid judging Maria's decisions. This means that the nurse should listen to Maria's concerns and understand why she is hesitant about treatment instead of blaming her. For example, the nurse can ask, "What concerns you most about taking your medication?" This can help Maria feel comfortable enough to share her worries. The second intervention is to educate Maria about hypertension, emphasizing that it is often a silent disease that may not show symptoms until serious complications occur. This means that Maria should understand that feeling well does not always mean that her blood pressure is normal. The nurse can explain that uncontrolled hypertension can eventually affect important organs such as the heart, brain, and kidneys. The third intervention is to explain the benefits of regular blood pressure monitoring and maintenance medication while addressing her concerns about side effects. This means that the nurse should explain why regularly checking her blood pressure and taking her prescribed medication can help control her condition and reduce the risk of complications. Since Maria is afraid of medication side effects, the nurse should listen to her concerns and encourage her to report any side effects to her healthcare provider rather than stopping the medication on her own. Therefore, these interventions are appropriate because they address the reasons behind Maria's decision, not just her hypertension. The nurse's goal is to build trust, correct her understanding of hypertension, addresses her barriers, and help her make informed decisions about her health while still considering her family responsibilities.
So now for our slide 11, we have additional recommendation that can help improve Maria's health and overall condition. So first, we should encourage affordable lifestyle changes such as reducing salt intake and eating balanced meals whenever possible. So this is important because healthy food choices do not always have to be expensive. We can also encourage her to manage stress and engage in light physical activities that are appropriate for her conditions. Then second, we can refer Maria to available government health programs that provide free or low-cost consultation and medication. So this can help reduce the financial burden on her while still allowing her to receive proper health care. Then lastly, we should involve her children in providing emotional support and encouraging her to follow her treatment. Having support from family can motivate Maria to take her medications properly and follow the health recommendations given to her. So, for our slide 11, the recommendation is to schedule regular follow-up visits through the barangay health worker. So, these follow-ups are important because Maria's conditions needs to be monitored regularly during during these visits. The health worker can check whether her condition is improving and remind her about her medications and healthy practices. And also, it identifies any problems that may need further medical attentions, and regular monitoring can also help prevent her condition from becoming worse. So it also gives Maria an opportunity to ask questions or discuss any difficulties she is experiencing. So in this way, health education is continuously reinforced, and she is reminded that she is not alone in managing her health. So, for our key takeaways, we have here the two important messages that we should remember. So, first we have is empathy is powerful. So, this means that listening to patients and understanding what they are going through can be just as important as giving them medicine. So, when healthcare workers show empathy, patients may feel more comfortable, understood, and willing to follow the care plan. Then next, for our second message, we have here the teamwork saves lives. So healthcare is not the responsibility of only one person. So every member of the healthcare team has an important role in helping the patient. So nurses, doctors, barangay health workers, family members, and even the patient herself need to work together. So overall, this slides reminds us that effective healthcare is not only about treating the illness, it is also about understanding the patient, providing support, and working together to achieve better health outcomes.
Good day, ma'am. My name is Steven Calamarabes, and I will be proceeding to the discussion guide. First, what model of health does Maria follow, and how does it shape her health decisions? Second, how do her biological condition and economic status interplay in her view of being healthy? And lastly, as a nurse, how would you respectfully introduce a preventive health mindset without dismissing her lived experience? For the first question, we have what model of health does Maria follow and how does it shape her health decisions? Maria follows the functional model of health, which defines health as the ability to perform daily activities and fulfill responsibilities. So basically, this means Maria thinks that she is healthy by asking questions such as, can I still do my daily activities? Can I still do my daily tasks? Which, based on this, she believes because she can still cook, sell food, and care for her children, she is healthy. Despite experiencing symptoms and having dangerously high blood pressure, which is 170 over 100 millimeter of mercury. And what are the risks of this? This beliefs shapes her health decisions by causing her to first, delay seeking medical consultation. Second, ignore warning signs such as headaches, chest heaviness, and fatigue. Third, refuse maintenance medication because she does not think she is seriously ill. And lastly, prioritize work and providing for her family over her own health. As a result, Maria focuses on her ability to function rather than on preventing future health complications. So what are the risks of this? Since hypertension can silently cause stroke and heart problems by delaying seeking medical consultations, by ignoring warning signs, by refusing maintenance, Maria is deliberately ignoring the future health complications, such as I've mentioned earlier. And what can we learn from this? If ever our body is telling us that we have a problem we shouldn't ignore it by thinking, ay maka-function pa man ko. We should get a proper lab and a proper diagnosis from a physician to ensure that we are actually healthy. And this could be also our basis for future health complications. And that is all for my part. Thank you.
Now, let's talk about how Maria's health condition and her financial situation affect the way she sees health. Maria has uncontrolled hypertension or high blood pressure. Her condition puts her at risk for serious problems such as heart disease, stroke, and kidney problems. The problem is that hypertension can be a silent disease. This means a person may have high blood pressure without feeling very sick. In Maria's case, she can still work and take care of her children, and because of this, she thinks that her condition is not serious. So even though she has symptoms and high blood pressure, she still considers herself healthy because she can continue doing her daily responsibilities. Maria's financial situation also has a big effect on her health decisions. She is the only source of income for her family, so she feels that she cannot stop working. She also has difficulty paying for her medical consultations and maintenance medicines. Because of financial problems, she sometimes skips meals and worries about the cost and possible side effects of medicines. And because of these circumstances, Maria sees being healthy as being able to work and earn money rather than being free from disease. For her, providing food and education for her children feels more urgent than going to the doctor. This shows us that poverty and family responsibilities can strongly affect a person's health decision. Now, as a nurse, how can we help Maria without judging her? First, I would acknowledge her sacrifices and responsibilities as a mother. I would not immediately criticize her for refusing treatment. Instead, I would listen to her and understand why providing for her children is very important to her. Then, I would explain to her that hypertension can damage important organs like the heart, brain, and kidneys even when she feels okay. I would also connect taking care of her health to her goal of supporting her family. I could tell her that taking care of herself now can help her continue caring for her children in the future. After building trust with Maria, there are several things that I can do as a nurse. First, I would teach her the importance of regularly checking her blood pressure. Second, I would explain the benefits of her maintenance medicines and also listen to her concerns about possible side effects. I would also encourage simple and affordable lifestyle changes such as reducing salt, eating regular meals when possible, and managing stress. Another important step is to inform her about free or low-cost health services and medicines available through the barangay health center or government programs. And lastly, I would involve her children so they can give her emotional support and encourage her to follow her treatment. The goal is not to force Maria, but to help her understand why taking care of her health is also important for her family. Maria's situation is not only about one person. Her case reflects what many people in low-income communities experience. Some people delay going to the doctor because they need to work and earn for money for their families. Chronic diseases like hypertension may also remain untreated because of poverty, lack of health knowledge, fear of taking medicines for a long time, and misunderstandings about the disease. This reminds us that health is affected not only by our physical condition, but also by our financial situation, knowledge, responsibilities, and beliefs. Lastly, this case shows us the important role of community healthcare providers, especially barangay health workers and public health nurses. They can help people by providing health education, encouraging preventive care, and helping patients access affordable medicines and services. Improving access to healthcare and increasing awareness about diseases like hypertension can help prevent serious complications. Overall, Maria's story reminds us that being a good nurse is not only about treating a disease. We also need to understand a patient's beliefs, financial situation, family responsibilities, and everyday life. By understanding the whole situation of the patient, we can provide care that is more respectful, realistic, and effective. That ends our discussion. Thank you so much.